So thank you for having me to come talk to your group. If more students join, welcome. So my name is Dr. Kate Thoma. I am a family physician here at the University of Iowa and a clinical associate professor. So kind of been asked to come talk to your group kind of about my path, kind of what I do, and kind of advice for the future. I have some kids that have helped try to tell me what to say at home, and so we'll see if I say the right thing. So but first, just a little bit about my path. So I am from Iowa. So I graduated from Spirit Lake High School with a class of 97 students, and then was pretty interested in medicine at that time, and was fortunate that I had a friend's dad who was an orthopedic surgeon who I would get to go into the operating room with him. I would go into his clinics as a high school student, which we can't really do now, but I got a lot of kind of guidance from him, and so knew that I was interested in medicine. I went to college up at the University of St. Thomas in St. Paul, Minnesota. I did major in biology, and I did minors in chemistry and psychology. Again, I knew I was interested in medicine, and there was definitely a pre-med path. I did not join the pre-med group. In all honesty, I felt like it was pretty prescriptive, and I wanted to be able to do, I kind of thought maybe it looked a little fake. So I volunteered at the local children's hospital and got involved in things that I was passionate about. And then applied to medical school and was accepted. And I think many of the people, at least in my class, did not get accepted to medical school who were in that pre-med group. And I think, again, that might speak to, you really should do the things that you love, and maybe not things that you think are going to just look good on a resume, because people can see through that. So when I got accepted to medical school, I being an Iowa native, coming to Iowa seems a lot cheaper because medical school is expensive, but I kind of panicked. I actually ended up applying to nursing school. I applied to be a flight attendant for an airline in Minnesota. I applied to pharmacy school, and I was just like, is this the right path? But really, this is something I had wanted to do my whole life. And so came to Iowa City, where I did my medical school. Then you have to choose a specialty. And so I had thought, well, I'd spent all this time choosing to be a doctor. Now you want me to choose what kind. And so I went every day. I thought I was going to be something different. My parents would be like, what are you going to be today? The things that I don't like are eyeballs and toenails. So those are the things that I just didn't like, but I loved delivering babies. I loved being in the operating room. I loved taking care of kids. And so family medicine was really the fit for me, because if I walked into a patient's room, if they had their kid with them, I wanted to be able to answer questions about both. Or if the child was there for a visit, I liked being able to answer questions that the parents might have about their own health. So I chose family medicine for my specialty. And then after you do medical school, which is 4 years, you have to do a residency. All of the residency programs or different specialties are different lengths of training, anywhere from 3 years up to 7 years. And so family medicine was 3 years, and I did that at the University of Iowa. And I have the wrong, no, I have the right date in there. Yep. And then I really like teaching. And so I realized a lot of the people teaching me had no teaching degrees, and that just because they were a doctor, they could teach me. And I wanted to get an education degree. And so we created a faculty development fellowship where I was able to get a master's in medical education here at the University of Iowa. So that's a little bit about my path here to becoming a physician. So a day in the life of being me, like, there's really no such thing. Like, I do so many different things as a family doctor, which is why I think is personally the best specialty. So I get to do well visits in the clinic. So that's babies, children, adult. I take care of patients with chronic conditions. So that might be diabetes. I manage depression, take care of high blood pressure. I take care of women when they're pregnant and get to deliver their babies in the hospital. I do procedures in my clinic. So that might be anything from taking a biopsy to prescribing birth control, or there are some birth control options that have to be inserted. I do those in my clinic. If you need stitches, I can put those in. So acute visits, so if you're not feeling well, COVID symptoms or sore throat, like I get to do that. I see my patients or other patients that have to, like after they get discharged from a hospital, I take care of patients when they're dying, and that might even include going to their home if they're on hospice. I see other patients who are at home as well if they're unable to come see me, and take care of sick babies in the hospital. So there's like every day is a little bit different. And as a family doctor, but then I work in academics. So I kind of look at my role as I'm a family doctor, I'm a teacher, and I'm a researcher. So the things I just talked about were a little bit about my role as a family doc. So I also teach not only my patients, but I have medical students that work with me. So they're learning how to become a doctor, and I might teach them either with my patients or in a classroom. And then I also teach our residents, our family medicine residents who are learning to be family medicine doctors. And then researchers, so whether particularly my focus is in education things that we can do better. And then doing some work right now on something called advanced care planning. So helping providers have conversations with patients about what their end of life wishes might be. So I think my advice for the future is kind of reflecting on things that bring you joy and like following your passions. And so trying on lots of different careers, and so you get lots of opportunities to shadow different things. And the other thing is, if you want to do medicine, I don't think you have to get a science degree. Like maybe you want to do English, you still take the science classes, or maybe you want to take anthropology, or like, again, do something that you're really excited about and passionate about. And I will, so I'm going to just show some data about the importance of primary care really quick, and then I'll open it up to questions. But, in the United States, like we don't rank very well amongst our peer developed countries for life expectancy. But so that's the bar graph on the right. And if you look at how much money we spend the most money out of other countries. And so we're really not getting the value for the price we pay. And the thing that's really different among these countries is the number of general practitioners of proportion of total doctors in these peer countries. So in other countries, they're much more primary care based as opposed to specialty based. And so that has a huge impact, not only on the quality of care that is provided to a community, but also to the cost, which I think is something to think about. And so this is like one of my favorite pictures of a healthcare system. And really, so it starts with 1,000 people. Some of those are going to see a physician if they have symptoms, but a lot of them are not. Less than one of them are going to come be hospitalized in my academic hospital. But as a family medicine, I think I get to take care of most people for most things most of the time. And I really, really appreciate being that for my patients. And there's a woman by the name of Dr. Barbara Starfield. She's actually a pediatrician at Johns Hopkins University, and she died in 2011, but she coined this term for primary care, which is that it's first contact, continuous over time, comprehensive, and coordinated. And so as a family doc, I really, really get the opportunity to develop relationships with my patients across time. So I get to, help families deliver babies, take care of them as they get older and see kids go off to college. I get to take care of, I might have older parents who I take care of their middle-aged children and maybe even grandchildren. I take care of a lot of middle-aged people who their parents who are older might move here and they ask me to take them on. So again, it's a really just, I think, a great opportunity to be able to provide that care. So with that, I'm going to stop sharing and see what questions you guys might have.
Students can unmute themselves if they'd like, or they can drop them in the chat. Either way, Dr. Thoma would love to answer any questions you may have about maybe her undergraduate experience or her experience during medical school.
Hi, I had a quick question. I guess it's more general, but what like helped you stay motivated through all these years of schooling?
Ooh. You know, I think, oh, I don't have my, I think knowing what brings you joy. And so like, I really wanted to be able, like, I appreciate being able to take care of patients. And so that was my motivation. I wanted to make sure I got those skills. When I started medical school, I actually painted a plaque and it's got faith, family, and friends. And so those were the things that were super important to me and my priorities. And so I wanted to make sure that those continued to be my priorities. And so this little plaque is a reminder of that. And I think our, you know, we can say these are our priorities, but if we don't spend time on them and invest in them, like, they're probably not our priorities. And so that kind of constant reminder of kind of having that balance, I guess. I don't know if that certainly helped me be positive about the experience. So I guess maybe motivated as well.
Thank you.
And Dr. Thoma, the reason we had gotten this started was because of our Young Women in STEM group that we have. Would you have any advice in particular for young women that are starting in? Are there things that they should know or be aware of that will help them? Yeah, so that was one of the questions that I thought I might get asked. So I don't think there's one. So one thing is that, and actually, I guess let me ask, are there more upperclassmen or underclassmen that might see this?
Probably upperclassmen.
Okay. So I think one thing is there are not better colleges than ones. I think you need to go look at several different colleges. You might look at big colleges, you might look at small colleges, and you need to kind of go experience that. And I think you will need to take some science classes and math classes if you want to do medicine. And so getting that experience while you're in high school, but don't only choose those as your electives when you're in high school, you know, so you get a chance to do language, you get a chance to do industrial tech, like there's all different options. And so don't think that you want to be rounded, well-rounded. And so try those other experiences, use your elective time to do some of those music classes. Don't feel like you only need to do the science, technology, and math classes, which are important, but trying to stay balanced. And I think trying to take advantage of job shadowing. I know the pandemic has made things a little challenging, but you know, what is it like to be a doctor? What is it like to have these, you know, to be an engineer? What's it like to work on technology on the computers? Like going to see what people do on a day in and day basis and be like, I think that sounds a lot of fun. Something that I say at home is, you know, what problems do you like to fix? Because that's kind of how we have to, that's what your job is, right? To fix problems. And so what things do you want to see get better, or what types of things?
And you work at a larger university in family practice. Why would somebody want to choose that over maybe a private practice, or what are the pros and cons to that? Can you address that?
Yeah, so I like teaching, and so I feel that I get the most teaching opportunities by being at the university setting. I also, there's a lot of information to stay current on, and by teaching, I really follow the model of see one, do one, teach one. By teaching, it really forces me to stay current and up to date because I've got to make sure I'm teaching my learners the best. And I think I get to see patients with really complex medical conditions. And again, that helps, like I appreciate helping patients with that, but I also think it helps me stay knowledgeable and that. It's definitely a big place. Sometimes I feel like it would be easier if I worked in a much smaller clinic I had always had my same nurses. And so there's definitely value in that as well. This is where we've ended up, and it's worked really well for us. We think Iowa City is great.
Have you started doing more, working with other doctors, now that technology is pretty much in the forefront? When you do get a complicated case, is it?
Yeah, that's a great question. So we have something, so sometimes as I mentioned, so as a family doc, I can take care of most things most of the time for most of my patients. Sometimes I need a lot of help, but sometimes I have a really specific question. So we have developed something called an electronic consult, which is kind of a fancy email to a specialist. So if a patient of mine maybe has a rash and I don't really know what to do, there's two types of ways we could treat it. I can take a picture of it. It goes in the patient's chart. I send my really specific question to the dermatologist. They look at my question, they look at my picture, and then they tell me what their recommendation is to do. So that is really nice for patients because they don't have to come in for another visit. We can get treatment started much quicker. And so that's one way that we've really used technology. The other thing is the pandemic has caused us to do, we're meeting by Zoom, right? So I meet a lot of my patients now via telehealth. So there's something, our computer system has something called My Chart, but I can see patients in my office sitting on the computer and they're at their home, particularly like they maybe don't feel comfortable coming in to see me. They can go to a lab to go get their blood drawn and I have the results. And so a lot of the things I can do over a computer, meeting face-to-face, particularly if they have equipment at home to get me some of their vitals. So that's some of the ways that I use technology.
And do you prefer to see patients virtually? What are some of the pros and cons of, virtual visits?
I do. I've learned some things about my patients when I get to see them at home in their home environments. So I think I like a little bit of both. What is a little challenging are days where I have patients in my clinic and scattered in there are some patients who are going to see me by computer. And if you're coming in by computer, you don't really have to check in or see my nurse. And so if I'm running behind and you arrive on time, like there's not nothing to keep you occupied until I am available to see you. So sometimes it gets kind of bottlenecked, but I like doing both. But something, again, patients of mine who have diabetes that I need to see more frequently, or patients of mine who have mental health conditions, it can be just as effective meeting on the computer as opposed to having them come in. So I like both.
And you mentioned mental health, and that's something maybe that you don't think of as a family physician, that they're, you think maybe you're going to refer them. Have you seen an increase in that, especially since the pandemic?
I have, and I think we are all, there's kind of adjustment, right? And so we are all trying to adjust to our current living situation. And I think particularly as teachers were returning to school and students returning to school. I think that was very anxiety provoking. And so, yes, we are definitely seeing an increase in that. And I think it's something we have to just acknowledge and talk about, that, yeah, this is a stressful time, and make sure that we're taking good care of ourselves.
Do we have any other questions? Students?
I can't
Dr.
see.
Thoma- Oh, sorry.
No, I was just trying to find the chat box to see if there's anything in there, but I don't see anything.
I have a question for you. Could you share what kind of activities you were a part of during your undergrad that you think helped in your application to med school?
Oh, yeah. So I, as I mentioned, so I went to the University of St. Thomas. I was an RA, so a resident advisor, every year, but my first year. And I think that was good, good experience. I volunteered at the Children's Hospital up in St. Paul, Minnesota. I went there every week, almost every week. And that was even times that I was like stressed and I had a test, it was a rewarding thing to do, and built some relationships with students that way, or patients. I was involved in track my first year of college and got to meet people that way. I did do some research in college, both with a professor that I was working with, and then I had the opportunity one summer to work with a physician in their lab. I think that helped my application a little bit. And then I was involved in our FCA group, so Fellowship of Christian Athletes. And I think, again, that was another group that was at least definitely provided support, but some activities there too. These are the ones I can remember.
If there was one thing that piece of advice that you could leave with students, what would that be?
Follow your hearts. Yeah, I think that there's and I still struggle with this. When I was in your shoes, I was looking for the right answer. Like, I wanted someone to tell me which college to go to and what should I major in, and just tell me what to do, because I will do it. And there's not a right answer. And that's really unsettling, I think, sometimes. And so people aren't, they're trying to help you when they offer these suggestions to you, but there is not a right answer. And what might be right for you is not right for someone else. So really trying to explore and see what is going to fit best for you. I compare it to finding jeans that fit. You got to try on a lot of different pairs until you find what you're going to like. So, think about colleges and try several pairs on. Think about majors and what might work best for you. And you just try things on.
That's really good advice.
Thanks.
I love the jean analogy.
Yeah, I use that one a lot. So yeah, it's good. It's true though, right? One size does not fit all, and you gotta try a lot on.
Jessica Sueta, do you have any other questions that you want to ask at this time?
No, not really. How did you balance your job and at the same time have fun?
Oh, you've got to do that. You've got to do that. So, that's we use the word balance a lot, and that kind of implies it's a teeter-totter, right? So that you're trying to get things balanced. And I think the word I like to use is blending. We really have to figure out how to blend. It's not fun or work. It's not family or work. I have to figure out how to blend these things in. So it might mean that I have to, I'm going to leave work early so I can watch my son play basketball, but I'm going to have to do work later tonight at home. It's kind of blending some of those things. And again, I think it's having a core group of friends and family that, you know, who know who you are and what your passions are. And so making sure that you're making time for them. As I mentioned, again, my plaque, my faith, family, friends, like doing a check-in to see, have I gotten together with my friends? Am I checking in with my family? I'm a quote person. So when I was in medical school, the bedroom that I studied in was just full of quotes everywhere, constantly reminding me like of, you know, things that are important and kind of positive things that would motivate me. So I don't know. I think you just, all work and no play is just not a good philosophy, in my opinion, for life. So I don't know if that helps answer your question, Swetha, or if there's something more specific.
I think it does a pretty good job of answering my question. Thank you so much.
Mm-hmm.
Yes, thank you, Dr. Thoma, so much for giving us some of your time today.
You're welcome. If anyone, they have my contact information. It's really easy, katethoma@uiowa.edu. So if there are questions that people have, happy to be a resource.
Awesome. Thank you very much.
You're welcome.
Thank you, Dr. Thoma.
Yeah, have a good afternoon, evening.
And happy Thanksgiving.
Thanks, you guys too.